Hello, Mervyn.
Hi.
Is it your first visit to Portugal?
Very first visit, yes.
And what are your first impressions of your visit?
I feel at home. I live in Israel, which is a very Mediterranean country. Sunshine, good food. I find the same things here in Portugal. Very friendly people, also where I come from. I feel very much comfortable and at home.
And also you had good luck with the weather.
Yes.
These sunny days. Here in Congresso, we just finished in Torres Vedras of Classical Osteopathy. What is the feeling that you have at this moment that we have finished all the works?
Right. I have a strong feeling that there is great potential here for growth, for development. I took a workshop yesterday and saw intelligent, keen students. That is the goal that you can work with. So I'm very optimistic that this new profession in this country can take root and grow.
Can you tell us something about your osteopathic life, if there is another life?
Yes. It started very early. Already at the age of 20, I began studying. And it was a very traumatic first 3 to 4 years because I questioned much of what I was hearing. It wasn't presented in a scientific way, and it was only because of the appearance in my third year of John Wernham as a lecturer that I began to think that maybe there is more to this subject than I was aware of, and he really saved my professional life as an osteopath. Without him, I would not have continued, and I would have gone in a different direction.
I think that this is very actual because nowadays our profession is always being confronted with new science and proofs and all this evidence-based, but also can you relate that moment of your beginning to the present day? You still think we are in the same ambience, or what changed?
I think osteopathy still has that tremendously strong tendency to go off into the clouds, to go off in terribly many directions and lose its feet, which should be on the ground. The ground is science. Osteopathy is based on science, based on medical science. Little John took osteopathy into the 20th century, but many osteopaths and many osteopathic colleges and schools go back into areas that are very little based upon good scientific thinking. They compensate by talking a lot of science, but what you actually see on the table is often very poor science. And that is a danger in osteopathy because we're dealing so much with the subjective. Touch, feel. Our diagnosis is subjective. It has a tremendous danger of losing its feet on the ground.
So let's say that osteopathy can have this danger of becoming too much esoteric.
Yes.
Can it have also the endangerment of becoming Scientology, too much cold and too much scientific without having his own heart, let's say?
Yes, it can go the other way as well, which it has often done in England particularly, where colleges are more and more trying to sound medical, to limit what the student is allowed to do, so as to become accepted by the medical profession. So it loses the fact that it is supposed to be osteopathic medicine, producing osteopathic physicians, ready to take and treat almost any condition that any other doctor would be treating. So it can go either way. And it's a very delicate balance, very difficult balance sometimes. But it shouldn't be too difficult to inspire students and yet also expect that they remain intellectually intellectually within the field of medicine.
But you were talking about students?
Yes.
If you were a student starting now the study of osteopathy, which country, which place, which teachers, which kind of osteopathy you would?
I would be in exactly the same sort of position as I was 50 years ago as a student. By the third or fourth year, I would be ready to give up and run away. I do not know of one single undergraduate college that teaches osteopathic medicine, not even in America, in a way that I would feel this is good science in action, on the clinic table, at the hospital bedside. Would I know that there are postgraduate training courses that would allow me to develop those skills, then maybe I would stay, become a graduate, and join the postgraduate courses.
Can we do something? What can we do to regain the real osteopathy? What can be done? You are doing it already.
Yes.
But maybe just one is not enough.
There are others. I have colleagues in the classical field, in the classical world of osteopathy, who are teaching all the time. I personally know those in England. And we have developed in the Institute of Classical Osteopathy a whole educational postgraduate syllabus. It covers 3 years. And that certainly is a very good start for those who graduate from osteopathic colleges who really want something more, something deeper, something that is what was practiced 120 years ago.
If you had something to say to, you know that in the United States we have DOs, that osteopaths are medicine doctors called DOs, but they have the same degrees, kind of different formation than in osteopathy, manual therapy. And you told me that in Russia it's also accepted and changing, but in the rest of the world, even places where it is accepted and under good legislation, they're not doctors. As an osteopath, what would you say to these medicine doctors regarding osteopathy? Because there is some conflict, some misunderstandings, and what would you say when you have a doctor? Because I'm asking this because I know you work in a hospital. That's the reason of my question.
Look, doctors who are osteopaths feel very threatened by those who are not doctors. They would like to close their world to themselves and not allow those who are not doctors to practice. I understand that, and sometimes they have good reasons. I'm not sure that if I wasn't a doctor and an osteopath, I wouldn't join them. I would see the dangers of people who are not properly trained, treating people sometimes who are very sick. I would see the dangers of trying to convince people that they can help them with their illnesses, when in fact they have very little clinical experience. So I would understand their efforts to close the shop just for doctors. It's up to us to reach high academic standards that are accepted by the country in which we live, that would recognize that we also have a place, even if we do not have a medical degree. It's up to us.
Mervyn, what still motivates you to practice and also to teach osteopathy? And do you think that you can do both things, or someone who teaches and practices is too much?
No, I don't think it's too much at all. One helps the other, one feeds the other, one motivates the other. I'll answer your second question first. Why do I teach? Because I made a promise. I made a sincere promise to John Wernham and an even stronger promise to Edward Hall, his teacher, before he died, that anything they teach me, they must realize will not stay with me. I will continue to teach to the next generation whatever they teach me. And I think that really did affect both of them emotionally. They understood that it was a very sincere promise. And I'm keeping that promise. And I'm happy to keep that promise. And in answer to your first question, which I've already forgotten,
is the practice. Why do you
why do I still practice?
It, not the teaching, the practice.
There are probably a few reasons. On the aesthetic level, there is a great pleasure as an artist to see your artistry improving. And that is, I feel, what is happening in my work. I feel I'm doing far better work now than I did 10 years ago, and far better than I did 20 or 30 years ago. So you get an emotional satisfaction of improving your artistry and your understanding of what the work is about. But the other great pleasure is to see the help that you can give to sick and injured people, to get the feedback of an elderly woman who could no longer wash herself, could no longer cook for herself, could no longer go down across the road to buy something for herself, to slowly begin to be a little more independent again. The pleasure it gives for such simple things to come back again gives me a lot of pleasure. And on the other end of the scale, to be treating a baby the next minute. 1 minute it's an 89-year-old, very sick old lady. The next minute is a little baby of maybe a month old, or a few weeks old, or a few days old. And it's the same hands, and it's the same technique, it's the same principles. And the next minute it's a sportsman, a healthy young man who can't move because he's in terrible pain. And the next minute it's someone who has a cardiac condition and chest pain. And the medication helps, but it's temporary. And he's willing to give you his body to rehabilitate, to restore health as much as is possible. It's an incredible profession. My colleagues in the hospital, their eyes open up and their ears when they hear a baby is in my room. And they say, what are you doing with a baby? You're not a pediatrician. So I say, come in and have a look. And then their mouths open. They can't understand. How are you getting these results with a baby and you're not a pediatrician? So the breadth of our work, the variety of our work, the pleasure that you can have as you see people slowly getting better. No miracles, no magic, but the work you put in very often gives you the reward. Doesn't mean you can cure the patient. Most of these patients are often incurable. They're too late. They come too late. They're too ill. But anything that can make life more comfortable already gives me that satisfaction. And I really don't see any thought. I don't have any thoughts about retiring. How can you retire with such skills improving? Like a musician doesn't retire. A violinist or pianist continues till he drops during the concert. So it's a great profession to be in.
What can you tell us about